iAware displays clinical numeric data every 5 minutes when it auto-refreshes. When we click the Minutes Ago button to manually refresh, and then 5 minutes after the hour for the volumes infused. Data displays with meaningful color. Data displayed in black font is data that is already validated and signed, so it does not require further signature. An example of this would be for when we begin a first bag infusion. Gray font displays data that is not changed, and it also does not require signature. An example of this would be when we hang a subsequent same solution IV bag at the exact same rate, or we have vital signs that we have signed that are unchanged from the last documented value. Purple font displays for data that is not signed or validated. This information will not flow to the patient's medical record in Cerner until it is signed. An example of this would be rate changes, our hourly volumes infused columns, and any boluses that we administer from an existing bag. Not all purple data needs signed. Only sign purple data from your infusion changes, from your hemodynamic equipment that is flowing data into iAware, and hourly infused volume columns for your active infusions or completed infusions. The frequency for signing all hourly volumes infused is based on the frequency standards for charting your infused volumes and clearing your infusion pump totals for your unit or patient population. For example, for neonatal patients, we usually sign and clear our pumps hourly. For pediatric, every 2 hours. Or for ICU settings, in the adult population, we may wait 8 to 12 hours. However, we do not want to wait until the end of our shift or 12 hours or longer, as data is only available for display for a rolling 12-hour period in iAware. For example, data that shows in iAware at 10 a.m. will only be available for verification and signature in iAware until 10 p.m., after which time it will fall off iAware. And then we as clinicians must manually document that data in the appropriate place within the patient's electronic record in Cerner, such as the MAR or the iAware flow sheet. To sign clinical data, we will select the purple data cells by completing a single click. We can also select columns for signature. And then finally, we can click and scroll across columns to select multiple columns of data. Notice the purple triangles that have appeared at the top of my screen. Purple triangles or arrows will display if additional unsigned results are not on view. The clinician would need to scroll either up and down or left and right to view the unsigned results before signing. Otherwise, those unsigned results will remain unsigned. When ready to sign the data cells, click the green check mark. Any hemodynamic data that was selected for signature or infusion-related data will now flow to the patient's electronic medical record in Cerner into the appropriate place, such as the MAR summary, and the iFlow sheet.